think you started to say it earlier. What's left? It is a big, giant, gaping wound. It's huge. And it's in a very vascular organ that for the last 8 or 9 months, the body has worked hard to shunt more blood to because it's growing another person. Sorry, I'm sure I'm being dramatic.
Yeah, that sounds like
it's
terrifying.
Not, I mean,
No, it's not terrifying. This is we're gonna get
cool,
to the
though.
magical part.
Yeah.
That's the reality of what it is. Now we're gonna talk about the magical way the body prevents the hemorrhaging. Okay, so you have to understand what a placenta is to understand where Loki is coming from. So when that placenta goes away, everything from the pregnancy should come out. But you have this big giant wound inside of the uterus. Okay. How do we usually think of hemorrhaging throughout the body, or how do we usually stop bleeding?
Pressure.
Okay,
Sometimes.
pressure. Yeah, pressure. What do we think of that the body typically does? Clots, right? Or it'll create like a scar or a scab in the form of clotting. That is actually not the primary way that bleeding is controlled at this site. Go ahead.
I was gonna say it shrinks and vasopressing.
Yeah, the muscle of the uterus contracts and squeezes, and it basically cuts off those little vessels from being able to bleed out. So that's why we care about assessing what? The fundus. First 3 letters are fun.
That's why it's
So-
bad whenever the uterus stops contracting.
Right, it can be. I've felt many boggy funduses and she was not hemorrhaging, but it's an indicator to us of how everything's going.
The Pitocin that's given
Uh-huh.
postpartum,
Uh-huh.
is that just to prevent?
It is to contract.
Is it given
It is-
to everyone?
No.
In U.S. hospitals, yes.
Okay.
I didn't
And-
get it until I hemorrhaged.
What do you say?
I didn't get it until I hemorrhaged.
Really? Were you on Pitocin for like an induction?
No.
Did you deliver very quickly that they weren't prepared?
I don't think my sister did. She delivered naturally. I didn't even. I think the hospital changed this probably after me. I didn't even have IV yet.
No, I bet they did change that.
So I hemorrhaged.
Was it a very,
It was at North Kansas City Hospital. So
oh, that's not very far away, okay. Huh. Was it supposed to be like a low intervention birth?
it was low intervention, yeah.
Okay, maybe that's right, but usually low intervention.
But
places
still,
make
after
you have
that,
an
I
IV.
always had an IV with
Yeah.
an IV place. I never had.
Usually low interventions will still make you have an IV, like a saline lock,
Yeah, saline lock.
not necessarily
IV.
running
Yeah.
fluids.
After that.
So maybe that's why they didn't give you Pitocin if things were going fine afterwards, until they weren't going fine. Do you guys remember when we were talking about maternal mortality? I said that the global maternal mortality rate used to be about 215 and now it's down to like 150.
Mhm.
One of the really big things that helped reduce the global one was in more remote areas of the world was getting Pitocin. Pitocin injections out into villages. So we readily have many things to stop hemorrhaging, but it's hard to stop a hemorrhage when there's not resources. And so that helped with the global rates significantly.
Mom hemorrhaged at home.
What?
My mom hemorrhaged at home. They
Like
missed,
after she got home from the hospital?
they missed preeclampsia.
Oh, was it while she was still pregnant? She
Mhm.
did?
She had my brother. Well, that was at 27 weeks, and then she.
Oh,
was
so she had
pregnant.
an abruption probably, like her.
Yeah, I don't know. They didn't take the baby, or they didn't take my brother right away. They got it to stop, and then at 31 weeks she hemorrhaged again.
Did she ask her if, I wonder if she had a placenta previa where the placenta's over the cervix?
Maybe that's what it was.
I bet that's what she had.
And they
Because if
missed
she
it
was
or
bleeding that
something.
heavy, if it was an abruption, they would have had to deliver him. But if it was the
Yeah.
kind where the placenta is laying over the cervix, that can bleed,
Mhm.
but not necessarily mean something bad is going on.
Yeah, they missed something, but
I bet they missed it.
she hemorrhaged at
How long ago was this?
he's 17 now.
Okay.
But
Ask her if,
yeah, I will, cause she she hemorrhaged at home. They got her to the hospital, or she went in for cramp. I don't know. And then she came home because it was my birthday, and then she went to go get in the shower and she hemorrhaged. So then,
That was the second time?
then she went to the hospital, and then
When
that's
you-
when they.
Says placental previa.
Uh-huh.
You said placenta's covering the cervix, and that can cause bleeding also.
It can cause bleeding because the cervix will start to slowly soften and thin out. And so because that's in the bed of the placenta, when it adheres down there, just little vessels will break and it will bleed, but it's not, if the baby still looks good on the monitor, they won't necessarily go deliver a 27-weeker unless they have to. If she's hemorrhaging the way she described and it wasn't a previa, it makes me think it was a true abruption, which the actual placenta is tearing away before the baby's out. They don't send people home for that, or if they do, they have to be very, very stable.
Yeah, my mom was stable and she hadn't bled for a few days, so they sent her home.
Okay, so
And then
it could be what they call a chronic abruption.
Yeah, I mean, they just told her, like, if you hemorrhage, you don't have time to take an EMS. Like, you have to go straight.
I would be terrified to go home if somebody said,
I mean, I would have been too, but.
blah, blah, blah.
How long after a C-section can you go home?
I mean, insurance has to pay for 3 to 4 nights, but I've seen people go home at 24 hours,
Okay.
especially if like their baby was transferred to a different NICU, or they have a reason
Yeah,
to
because
like.
my sister's second one, they were both C-section and IVF babies.
Uh-huh.
The second one she went home, and after she was home for like a day or two, she hemorrhaged,
Oh.
and then was in ICU for 3 days, and had 5 blood transfusions.
Poor thing.
Yeah, so like, I don't know, it was just weird, like how, I don't know if they know exactly what had happened or not.
You can hemorrhage. Usually they call it an early hemorrhage if it's within the first 24 hours, and then anything after that they call it late. So whether it had anything to do with when she was sent home or whether it would have happened, that's hard to say. Did she just pass out, or did someone?
She was about to, yeah, and then they called the ambulance and they came and got her, and then when
So someone was with her?
yeah, her husband
I
was.
always get worried, like, what if that had happened?
Yeah, it was last semester, and I had to live with her newborn and 2-year-old while her and her husband were in the hospital. So that was fun.
That's a fun thing to balance.
Oh yeah, it was a great time. I was like, yeah, I don't want kids yet.
Yeah, it was a complete placenta previa.
It's good birth control, right?
That's what it was.
Oh,
complete
yes, okay, so that would make
placenta
sense
previa.
that they would send her home, and then a lot of times if those keep bleeding profusely, then it will deliver.
And the placental previa, if it's time to deliver, they'll do a
They
C-section.
have to do a C-section, if it's a true previa.
Did she
you
do-
cannot.
Yeah, that's what
Did
my
she
mom
do
had to have
C-section?
C-section.
Sometimes early on, it looks like a previa, but the uterus is still small and it's adhered down by the cervix. And then as the uterus grows, it doesn't actually move, but it seems to move. And so then they're eligible for a vaginal delivery.
If it's like fully over the
Yeah, if it's a
cervix,
complete previa.
then it's not gonna move.
They're basically
But if
blocking
it's-
the exit.
Yeah.
But it's not a problem unless it continues, like the.
Yeah, they're gonna bleed at some point. It's
Yeah.
usually later. 27 weeks actually sounds a little, did you say 27 weeks?
Yeah, she
That sounds a
said,
little bit early.
she said that it was either not found or it wasn't there yet. I had to look at it.
Usually as they get closer to like 32, 34 weeks, that cervix is gonna start thinning out because it's prepping for delivery in a little while. And when it literally is remolding itself, all those blood vessels that are embedded in it are gonna start bleeding. And it's always gonna look like fresh blood because it's just at the very top of the vagina. Versus an abruption, the placenta is often higher, and so that blood, by the time it comes down, often looks darker or older. So, but when she said sent home, I'm like, that sounds more like a previa. Okay, sorry, we're off topic. Well, actually, we're on topic. Partner topics, not postpartum topics. Okay, so we understand then that where the loci is coming from, right? It is a mixture of lots of different types of tissue, blood included. And the color change results that we want to see the colors change, and if they're changing in the right order, that's an indication that that placental site is healing. So what colors what's the sequence it goes through?
Dark red.
Yep, dark or bright red. And what kind of lochia is that called?
Rosa or something like that.
Rubra? Yeah, lochia rubra. Yep. Rubra, think red. Like ruby.
Then it's brownish red or pink, which was the Saros.
Yeah. So then in like around 4 to 10 days, somewhere in there, it's gonna gradually change to like this pinkish, brownish, older looking lochia, and that's called lochia serosa.
And then 10 days it's yellowish white, which is
I think 10 days is yeah, I think that's misleading. Yes, but then it turns to what kind? Lochia alba, yeah.
Like after anything after 10 days, is that what it's saying?
So I don't really, you guys can know the general guidelines for days. What is more important to me, because every woman is different, is the big thing is that the amount is slowly reducing and that the color is progressively changing.
Do you want us to know the actual names of the colors?
Yes. Alba is the last one. So the first one's lochia rubra, which is mostly what you're gonna see in the hospital.
Would
And
you say
then-
that's similar to like menstrual?
Oh yeah, yeah. And honestly, to me, when a period is heavy, that's what lochia rubra looks like.
Uh-huh.
If you're a female, you know how sometimes at the end of your period it looks browner or lighter or
Yeah.
just not the same. That's a lot of what like serosa looks like.
Gotcha.
And then alba, when it's truly alba, it's gonna just kind of look like cervical discharge or yellow. It may not even be as easy to see. So whitish, yellowish. So the big thing is that we want the amount lessening and we want the color changing. And we get worried when the color goes backwards. So if she got to serosa or almost alba and now she's having bright red again, that's a problem. If she is a week or 2 out and has been doing fine and now she's passing big clots, that's a problem. That tells us something's not healing or something's going awry.
Which one did you, or when should you expect the clots and not expect them?
I would say that the first few hours we will see clots. A lot of times the first day or so, there's a couple of times you may see clots. If she's been in bed for a long time, it will literally sit there and coagulate. So before I freak out and think, oh my God, she's hemorrhaging, we're gonna talk to her and ask questions. So we'll get to that in just a second. You asked about clots. Any other questions before we talk about just the basic assessment part? Everyone's understanding what lochia is? Okay. All right. So lochia, in my opinion, is somewhat hard to assess. Why?
Because everybody's different.
Everyone's different, sure.
And you're absorbing it on something.
Yeah, it's usually on a surface that's gonna absorb, okay? What else?
You can't really measure it.
It is difficult to quantify, right? Don't we like objective measurements? Subjective measurements are very difficult. We like numbers. We like things that 10 different nurses would assess exactly the same way. And lochia is a little bit more challenging because it's just harder to make an objective measurement. All right, so when you did your paperwork, what did you see that are the normals for lochia in the first 2 days? You already talked about color, which would be the rubra. Did you see anything about amount?
How many pods or so? That was a different question.
Number 8.
Look on number 3 under lochia.
I just have like 2
the-
hours after birth.
Number 8 talks about the method
Oh,
for
yeah,
measuring
yeah. That's
estimating.
okay. Yeah, the number 8 will tell you the words I'm looking for.
Yeah.
Okay. Yep. Yes. Okay. I usually hear them say like scant, moderate, heavy. All right. Now, what on that question? What were the answers that you put down? 'Cause what did my question say? How does the book tell you the standardized? Okay.
Method for estimating lochia.
Okay. So what did the book teach you? Tells you if it's a scant amount.
The amount, like a centimeter, the width and length,
Yeah. What was was light?
Light, yeah.
less than 2
Less than-
centimeters.
Yeah, blah blah blah. Okay, and I think they even had a cute little picture, right, with
Yeah,
like
screen-
3 or 4 pads.
Four
Okay.
pads.
All right. What is the problem with teaching lokia assessment with that method?
Well, you're not
How
gonna
thick
sit
is
there
the
and
pad?
measure it.
You're not gonna sit there and measure it.
And how thick is the pad? How much is it?
Okay.
Or is it?
Well, how long has the pad been?
Yes! I think that's teaching someone to just look at a random pad and based on that one pad be able to say, oh, you're bleeding light. Okay, so I think, is it number 9 that's got the fill in the blank? Yes.
Yeah.
Okay, this is my favorite question. So, can you read, what does it say?
Any estimation of local flow is inaccurate and incomplete without consideration of the time.
Time factor. So what does that mean to you? I think that was the second part of that question. What does that statement mean to you?
Somebody's, yeah,
Rate, okay?
somebody's pad could be like dripping, but they could have had it on for 8 hours versus somebody that had it on
Correct.
for an hour.
Correct. So I don't like that method of teaching to look at the pad because it tells me, oh, so if 2 people have full pads, they must both be bleeding heavy and they're hemorrhaging. But just like Stephanie said, I'm gonna be way more concerned if I just put that pad on her a half an hour ago than if she's been in bed all night sleeping because her baby's in the nursery being formula fed. In that case, I would expect it to be full and spilling over. She's been in bed for 8 or 9 hours. And I'd probably expect some clots when she stands up because she hasn't gotten up to move. So yeah, I put that on there because it's dumb. Okay, so now that I've explained the dumbness of that teaching approach, how are we actually going to assess our patients and figure out if their bleeding amount is okay? Because we can't, just because it's hard to assess doesn't mean we get to not assess it.
Go from the last time the pad was changed.
Yes, yes, that is a great question. So I usually say, when we go assess our patient, let's say it takes us 15 minutes, I'm going to be looking at her pad and assessing her fundus for a 15-minute window of a 24-hour day. She's the one that's going to be managing her lokia the other 23 hours and 45 minutes. So I need to talk to her. Not all of our assessments require, stethoscopes on breasts.
Hey, I
some
looked
of
at
our
my mug.
some of our assessments are verbal, right? So I always ask, how long have you been wearing the pad that you have on? How long has that been there? Okay. So then, based on that, I can see how much is there and make an assessment partially. What else can I ask her?
How it has been in before
Yeah.
this pad.
Yes,
Like,
I
is it-
typically say, how often are you changing your pads? And then the follow-up part is, when you do change them, how full are they? Because how often do we tell moms to change their pad?
Every time they get hair in your name.
Every time they get up to the bathroom.
Yeah.
So if they get up to the bathroom, even if they don't have to have a bowel movement or urinate, they just want to clean up, change your pad. If they just have to urinate, it's only been an hour, change your pad. So I want to know how often she's changing it and how full it is. And usually I'll say like half full, a fourth full, totally full. And if they tell me it's full, I'll say, okay, the entire thing is covered. Oh, no, they'll correct themselves, but get a visual for what they're saying. What else could we ask them that could give us an indication of how heavy their bleeding is?
You could ask, kind of like to determine if it's heavy or not, if it's less or more than the normal menstrual
Yeah.
cycle.
Yeah, and you could say, is it getting lighter than when you first delivered? You could say something like that. Is it like a heavy period? Or lighter? And then I usually say, are you passing any clots the size of an orange or bigger? Or an egg, whichever food you want to go with.
An orange or cutie?
Cute.
I usually say orange.
The oranges are huge.
Yeah,
Wow.
we just.
Actually, with that, they come out.
Yeah.
I mean, think about the size of a baby's head.
Yeah.
That's
Yeah,
bigger
clot's
than
nothing.
One of the cutest things moms do is they'll leave the blood clots in the toilet and then when you come they'll be like, I saved the clots for you. And I'm like, thank you. And then by the time you go look, it's like disintegrated, so it just looks like, and it's like, she did that for me and now I can't even see it.
That's a great one.
Go look at the toilet if you want.
Yes. Okay, let's see. Okay, fundus. I'll show you guys how I do a fundal check in just a minute. I usually put on gloves, and then while I do the fundal check, I'll pull back and look at her, I'll put back the underwear a little bit and look at the pad. And while I check her fundus, I kind of give a little push just to make sure. Sometimes they're really good at hiding clots and stuff, and if you give a little push, stuff will come out. You don't really want that to happen, but it at least gives you an idea of, is the pad I'm seeing accurate for what's going on right now?
Don't you normally see like blood and stuff?
Oh yeah, you'll see.
Yeah, I was gonna say.
So that's a good question. How, usually scant to maybe some moderate amount is normal. You usually start calling it heavy if they're soaking through a pad an hour or a pad every 2 hours. But as long as they're changing it every few hours and it's not full, they're typically doing just fine.
So how long should they like be, is there like a time where you're like, okay, if you're still bleeding, you need to.
Good question. So that's why I kind of don't like how they do
10-day
the.
things.
Yeah, I don't like that because I think that makes it sound like if you're still bleeding after 10 days, something's wrong, and that's not true. Most of the doctors I've worked with said one thing they think impacts it a lot is a lot of times bigger babies have a bigger placenta, so it takes longer to heal that bigger placenta site. Somebody who had twins is gonna have 2 placenta sites. I know with my first child, I think I was bleeding and it was getting better, but it was like 5.5 weeks before I was truly, but then like one of the other ones, it was like 3 weeks. So, and I think 10 days just, that,
Yeah, how is
I
that
don't,
going
yeah, and I think
to
that's
heal?
very misleading.
Yeah.
I want you guys to kind of know the general idea. Usually in the hospital, you aren't going to see serosa. The only time you're going to see serosa is if it's like a C-section mom, because they're there longer, or someone who stayed longer for something else. But if it is just a normal delivery, you're usually only going to see rubra.
Okay, this might not be on it, but when do they start getting their actual period then?
Good question. That is very woman specific.
Yeah.
And has a lot to do with what route she's feeding. So if she's bottle feeding, she can start ovulating right away and having periods right away. Breastfeeding, typically the hormones that promote breastfeeding fight fertility.
Progesterone, is that from-
And yeah, in some women it doesn't matter what they do. They
So
yeah.
I bleed for 8 weeks and then I think 4 weeks later I start my period.
That sucks.
It sucks, yeah.
Yeah.
And I breastfeed
I know
exclusively
some
with
people
all 3 of
who-
my girls, so it's not like.
Yeah, I know some
they're-
people
that's
who
all they do.
breastfed and like it was like 22 months before they had a period.
That's how my mother.
And I'm just like,
Yeah, like, I'm
okay,
not
after
eating.
12 months, the kid's like walking around, eating regular, like, so for that person, it just lasted way longer. And also, you should know though, just because your period hasn't come back, does not mean you're not fertile.
Yeah, that's scary.
Yeah.
My
So
sister-
some
yeah.
women never have their period because they think they're not fertile, so then they get pregnant and go straight to not having, Okay, questions about, I wanted to show you guys, there will be, at each hospital that we use, there's several different, sizes of pads. I think a lot of people are used to thinking of these as menstrual pads, but usually after having a baby, the common size, it's this size, but this one has an ice pack on it. But it's just a pad. It's pretty giant.
Does it open up or does it just stop?
Yeah, this does. I don't,
You
I
can
used
wear
to
the diaper
have,
with the ice pack in it. The ice pack open over
I'm so sad.
They're like white.
Yeah, so just pick, this would come out of the package. This one's wrapped up because it has a disposable ice pack on it. But this part is a normal large pad. These are what I feel like you normally see most of the time, these big ones. And they're big, not necessarily because they're bleeding that heavily, just because they want to catch the bleeding and not have it get on their clothing. We also usually give them Victoria's Secret fishnets that are so sexy. When you guys tour the unit, ask, there's usually like 2 different sizes and there's 2 packs, but there's lots of these throwaway kind, so make sure the moms have plenty of these. If you help them up to the bathroom and you notice they have blood on them, change them out. That's why they're not
And you put
fancy.
the pad on.
Yes,
that.
and honestly, I'll show you guys how we do peri-care in a minute. I don't even mess with the little sticker things on the back. I just put it straight on there and work with them, and because these things don't, we put the sticker on.
Stick on it anyway, it just pop off.
And I'll show you guys how to do it, because if you don't do it just right, when they start to pull it up, it'll flip into the toilet, and that's not fun either. So, okay, so we've got underwear. I rarely see people use this size, and usually if they do, they've been there for a while and they probably had a C-section. Typically, C-section moms don't bleed as heavy. Do you know why?
It was pulled out.
Yeah, they suctioned out a lot of the uterus when they delivered the baby, so a lot of that debris was already sucked up. They have some low key, but just not quite as heavy. Okay, my favorite are these guys. Aren't these cute? They didn't used to have these really big ones a long time ago, but one thing we started using them for was our C-section moms. When they first come out of the OR, they're usually laying flat, and they have a Foley catheter. And I don't know if you guys have ever taken care of somebody with a Foley catheter that is bleeding from their perineal area, but the blood hugs catheter, so it doesn't, yeah.
Sounds horrible.
So when they're laying flat, it just goes everywhere. But if you put one of these under them, that's much nicer, right, than just bleeding all over yourself. So, and some people will use these big guys.
So where's that place at?
Usually when they come out of the OR, they're flat, so it's just gonna be right under, like, here's where their bottom and their
Okay.
crotch would be, so this will go a little bit up the
In the
back.
back, okay.
And this
So
they'll
it's like-
sometimes pull forward.
It's like a normal pad, it's just bigger.
Yeah.
Yeah.
And,
So it's placed like a
I
normal
think
pad.
that's what I was thinking, but I wasn't. I think it's Amy Schumer. Isn't she a comedian?
Yeah.
She has some post where she's wearing one of these and was just talking about how sexy it is to have a baby, like walking around wearing one of these diapers. She called it that, not me, but yeah, some women will wear it walking around, but I typically see these more for the moms who are not able to move, to just try to catch some of that stuff so it's not getting all over them. Okay, let's switch gears and talk about perineal hair, since it relates to lochia and then it relates to the laceration and episiotomy. So lots of hospitals will have some sort of ice pack they can use. I don't know what Women's and Children's has, but you guys will find out. When I've taken students to St. Mary's, they actually take a baby diaper and you can open the end and put ice into it, and they use that for their ice packs for moms. These are just disposable, so you bend it, you fold it in half and you'll hear it pop, and you shake it and it gets cold.
Can I see that?
Yeah. Are you not believing it? So do you see how the ice pack part is on top and then the pad's below it, but it's connected?
Okay, so when you put it on, the ice pack is.
Yeah, before you put it on, like if I'm gonna go help a mom put this on, I'm gonna bend this and pop it, and then I'm gonna shake it, and I'm gonna feel this get cold, and then I'm gonna put it on her.
Oh, so the
So
ice
it's
pack
an
is what
instant ice
touches
pack.
first.
Yeah.
That's what I was getting
Yeah.
confused with.
Okay, what else can we use for perineal comfort? There's been several things on your med profile. Tux pads, that's right, good job. So that's something else you'll either get for your patient or they may have at their bedside already. I guess I need to use this big one because I can't find the big size. Most nurses are going to teach them to put it in a stoplight pattern. Somebody one time was like, oh, like a snowman? And I was like, sure, if that helps you.
You're right.
It looks different on here because usually I'm using the one of those orange size pads. But you're going to put 3 in a row. And I always tell them, okay, when we pull up your pad, let's make sure you can feel this part of it against the part that's hurting.
This is kind of off topic, but the same thing with witch hazel. So if mom has hemorrhoids really bad,
Uh-huh.
they can also use the witch hazel pads in the pad with it.
In fact, one of the things we're gonna talk about actually says hemorrhoidal cream, but we use it.
Yeah, that's how you,
Yeah.
you see it at the store.
Yeah. But I always tell people all that tissue is very close together. Okay, so witch hazel is gonna have like a cooling sensation. Typically, these things don't cause any sort of healing, they just help with the discomfort. Okay, so you'll see lots of Tux pads be used. Anything else on the med profile that was used for perineal pain? Yes, Dermaplast spray. It is a first aid spray. You can buy it over the counter. I think they're blue now on the top, but it's first aid spray. It says for cuts, scrapes, and bee stings. Oh, and tearing your crotch. Maybe. The active ingredient in this is a cane, benzocaine, so it's like a topical anesthetic.
Whenever I was doing my profile, I couldn't find how much you were actually supposed to use. Can you?
Yeah.
Just says thinly.
Huh? Divorce.
Apply thinly.
And don't use too much because it can close the
Yes.
But how much
whatever,
is too
I forgot
much?
what it's called.
You would just do a spray.
Isn't
Okay,
it like
yeah.
6 times up to?
I usually hear not to use this more than 4 times a day. Because if you use it too much, it can have the opposite effect and cause chafing and irritation. So you don't want to do that.
Yeah, because I was like, could not find a dosage. I was
Yeah,
like, I
it's-
don't know.
Some of these are really hard to have a dosage for because they're topical.
Or like their adverse side effects because like the witch hazel is like more natural.
Yeah, so it's like
Yeah.
skin redness.
Did you
yeah.
use the witch hazel as much as you wanted too?
I think
Me
the witch
or-
hazel was as much as you.
Yeah, the Tux I've not seen a limit. Okay. Yeah.
I got this like.
You did?
Yeah. I read like the container on Google. And I think
Oh,
it said
well, then
up
we
to like
should change
6
that.
tons.
Oh really? I think so. I've not seen us limit that ever. And I've
Yeah.
never heard someone have a problem with.
Like, you've had it 5 times, you're only getting one
Well,
more.
you can just leave it on you, like.
Yeah.
Usually they change them when they change their
every
pad.
time.
I will say that I usually show women and tell them to just spray it directly on themselves. Some people think it's like too cold or shocking, so they can also just spray it onto the Tux pads or onto the pad if they want. So you can use Tux with Dermaplast. Okay. The other item I wanted to show you guys, and I need to ask Lauren if we carried this at Boone and I thought it worked way better for patients than the Dermaplast. Are you with your hand up? No. Okay.
Sorry.
I believe I have this Dibucaine or Nupercanol on your profile as well. Does that sound familiar? Dibucaine ointment?
I don't.
Really? Okay. If no one does, then
I haven't gotten to it if I.
So the Nupercanol I think is the generic name. Dibucaine I think is a brand name. But listen to the cane word. It's a similar. This one, Dibucaine is the active ingredient. It's another topical anesthetic.
I think when you look that up, because some of those aren't in our drug book, and
Yes.
you have to, search them. That one comes up with it. I'm pretty sure.
I thought I would have put this on there.
It comes up like underneath, like it's another
It's
cane.
cane,
Like they
yeah.
put them all
No,
in the same drug
no.
class together.
It's
I
not
think
in
I
the
put on the
profile, it's
instructions though that there are some of those meds you're not gonna find in a drug book.
Yeah.
You're gonna have to look
Yeah.
and because they're over the counter and they're not as regulated as. Anyways, this one literally says hemorrhoidal ointment. But we use it quite a bit for the same types of pain in that same region for women, and I find that women think this one works better. I also haven't heard this one limited like the Dermaplast. So usually, when I had this accessible where I worked, I would show them how to do the stoplight, and then I would tell them to put a stripe of this right down the middle. And then when we pull up the pad, I would say, make sure you can feel the cream touching the part that's hurting, where they're burning at.
So they ever put it on just like right on them, or do you always?
They can. There's nothing wrong with that. I think we tend to avoid that because of the risk of infection, and if they have stitches and stuff, I don't know that I want them. If their hands are washed
That
though,
too, yeah.
why shouldn't they be able to, you know?
I mean, I found it up to 6 times a day on directions.
Great, for
Is
Tux.
that okay if it's
guys gotta calm down.
We like the real details and.
I'm glad. Okay, I should have started, I'm so sorry, with this thing. This is far more important than the things I just talked about. What is this magical device for? What is it called?
Well,
first of all?
you don't wipe, you use that, right?
Kind of.
Okay.
What's this device called? Harry bottle.
Oh.
Yeah.
I think I just put whatever area it's supposed to be for in front of the word bottle. So, Harry bottle. Harry bottle. This is a very important thing that we use on the floor. Why? Why is this so important?
Because it rinses everything off.
It does rinse things off.
Don't want them using toilet.
And why is that important?
Reduces risk of infection.
Yes, the main purpose of this, I think you should know this, the main purpose of this is reducing the risk of infection. I think there is a place in the book where it talks about how this can help with pain and discomfort, but that is not the main purpose of this. One of the best pieces of teaching advice that you can incorporate into your care is that every single time they get up to the bathroom, they should be washing off with a bottle of just plain water, whatever temperature is comfortable to them, front and back, full bottle, and changing their pad.
They use a full bottle each time. Okay. And are they wiping with toilet paper or they're using
Good
that?
question. So a lot of places, first of all, they're allowed to wipe with toilet paper. It's not like we don't let them have any. But some places will put like some gauze or we call them OB sponges at Boone. It's like kind of like it's almost like wool. Yeah. I think they dissolve when they're flushed. But some places will give these to them and let them wipe with that because they're softer. So that's fine. If they use toilet paper or really anything they need to pat dry.
So with that, is it just water or do you put soap in it?
No, no soap, just water. Yep. Okay, any questions? Okay, the other thing I wanted to show you guys, this is another one of my big giant soapboxes that, if you remember from this class, one is placentas, and this thing is the other one so far. Did you guys read anything about a sitz bath? Okay, what did you read about it?
I do it twice a day for 20 minutes.
Okay, twice a day for 20 minutes. Yep, warm water.
Isn't that the mild soap?
No, this one doesn't have soap.
Where am I getting the soap thing from?
I think they're like something you clean.
I think
Oh,
there was.
it's the little bulb.
Yeah,
That's what I'm thinking of soap.
I think they might also say that like for washing like their breast that they can use mild, that they don't have to scrub it. But I think they might say like
That
and
is a bulb sponge.
yes, don't scrub it, but let soap run down. Yeah. Okay, so a sitz bath is, I don't know why it's called sitz. I don't know where the origin of that is, but it is just water. I think there was a time years ago where they recommended Epsom salts to be added, but they don't anymore. So if anybody ever says, am I supposed to add anything to this? We don't recommend that anymore. But what it is, I typically tell people it's like creating a little whirlpool for her perineal area. Which I know sounds weird, but that's what it is. Okay, so this is one that they can take home. At Boone, we had these really great big marble ones that they could sit in. It was so great. But they don't have them at the local hospitals, and I don't think Women's and Children's does either. But they should all have these in the clean utility room. And it's gonna have what looks like an enema bag with it, but we're not gonna use it as an enema bag. Okay, so what we're essentially going to do is this is going to sit on the toilet. Usually you have to raise the lids, and this is gonna then sit in the bowl. And you'll notice it says front on it, so you guys know where that goes, front of the toilet. And there's holes in it so that when it starts to get full, it's going to spill into the toilet. so it won't make a mess. Okay, so what we're gonna do is, usually if you have something that's measuring temperature, which most sinks don't have, but usually around 100 degrees is what a lot of people like. But you're just gonna do it by feel, or let the mom feel, tell you what a comfortable temperature is for her. And you're gonna fill up this basin with that warm water. Set this in the toilet. Then you're gonna make sure this is kinked off, or else you'll have a big mess. And then you're gonna fill up this with the warm water as well. And notice it's got a little hook spot. So usually most bathrooms have like a robe hook or something where you can put IV fluids or something like this. So you'll just find the hook. And then once you've got this filled and this filled, the end of this goes in this little notch down here at the bottom. Okay. So everyone can see what's gonna happen here, right? This is already full. She's gonna sit down where her laceration or episiotomy is gonna be slightly submerged in water. And then when she's comfortable, we're gonna unkink this. And it's gonna take 10 or 20 minutes for this to slowly empty into here. And it's gonna create this whirlpool. Now, why can't we just put her in a bathtub? Why do we have to?
So you're ready for infection.
Yes, we do not want stagnant, non-moving water. We want the water to be moving at all times. Let's keep in mind that, why is there a high risk for infection?
It's already
What's
irritated.
Well, the laceration's not anymore, but the
Okay.
vaginal opening is open.
Yes, so the vagina itself, which is a tube, right, has already been stretched and is probably a little bit shrunk down now, but what's at the top of the vagina? The cervix, and it's still gonna be open. It's probably not still 10 centimeters open, but it's wide open. And then you've got the whole uterine cavity, a good portion of which is an open wound, right? And that vaginal opening is right by what? The urethra, right? Where she urinates out of, and not too far away from the anal sphincter, right? Where she has the bowel movement. And then on top of the fact that there's already those three holes very close together, she could have a laceration or multiple that have been stitched up. Then on top of that, you have lochia coming out.
How long do you get your bath, like 6 weeks sometimes?
Yeah, you're not supposed to sit in stagnant water until you're cleared by your provider. Okay. Yeah.
Quick question. So when you fill up the bag usually also lasts about 20 minutes?
10 to 20, something like that, yeah. And you can fill it back up again if she wants it, if it doesn't last long. But the holes at the end of this are pretty small, so I think it takes quite a while to empty this.
So I personally never had this even offered to me. Is
Yes,
that because-
you know what? Let me just tell you how many nursing students from Lincoln have gone to the different hospitals and said, my patient's still having a lot of pain and I've already given her ibuprofen and Norco and she has Tux pads and she's got all this stuff. Where are your sif baths? Do you know how many nurses will say, oh, we don't have those? And then we go in the supply room and they big fat do have them? Yeah, that's how well it's taught. But let me just tell you how many patients I have had over the years. I'm not pushing these just for the fun of it. I have had so many patients over the years where we're giving Vicodin every 4 hours, ibuprofen every 8 hours. They're using all the topical stuff and it's not touching their pain. Or it is, but not to a comfortable level, and they're still walking around like this, trying to take care of their baby. I can't tell you how many moms I've said, okay, the last thing I have that we can try, let's just try it. If you don't like it, and you don't have to do it again, but let me help you the first time, let's just try it. I've had so many moms do this thing with water and walk out of the bathroom and go, oh. And I don't think she'll mind me telling you this. Mindy had a baby last semester. And she's heard me do all these things, and it was her first baby. And I think she had already gotten home, and she said, how is it that I'm supposed to do a sitz bath? Because she was having a lot of discomfort. And she texted me later and said, you're right, that was heavenly. That's what I needed. So I think it's fascinating that water can do more in some cases of pain than Schedule 2 narcotics.
So, like, is that something that, do we have to have an order for it?
No.
I assume not.
Well, usually the order is on like the postpartum
Yeah.
order set, yeah.
And
But no,
is-
it's not considered a medication.
And do they have to, like, is that something that we just, like, okay, it's your, like, you need to do it now, you have
No,
to do
it is not a required thing.
Okay.
That's why most of the
Yeah.
nurses don't even know this is on the floor.
Okay.
I also think some people don't like to do extra work, like they think I gave them their 2 pills, and we're not gonna be those kind of nurses. But that's why I push these so hard. If nobody ever got relief, I probably wouldn't believe in them. But I've had so many patients. This was the thing that finally gave them relief. You've had 3 children, and you haven't. Yeah, I've had so many patients that I took over on for the day of discharge. Their pain is always high, and I say, have you want to try this before, you know? And it's sad to me how many get close to discharge and never heard about the water bottle. So it is crazy, but I started doing my assessments. I would just say, now are you using the water bottle every time you get up to the bathroom? Because that's one way to find out if they know about it. The other thing I learned is that some moms that deliver in the middle of the night, the nurse probably did show her all that stuff, but if the first time she got to the bathroom was like at 3 a.m. and she'd been up she may not remember all the things that are taught, so it's good to refresh.
So they can, would you say they can do it more than twice?
Yeah, I would,
Yeah.
because I don't think it's gonna hurt anything.
Yeah, I didn't think so.
It's
water.
Yeah.
It is water, you're right. Just so you guys know, because people often say, well, there's ice packs and this, a lot of textbooks tend to say ice for the first 24 hours, heat after. I tend to say whatever the heck she thinks is comfortable, why not? This is the only thing of all the things I've shown you that I would say actually does have healing capabilities. It actually helps with healing because that warm water causes like the white blood cells, increases blood flow, and it actually helps with healing of that tissue.
Do you have to wait a specific period of time after?
I've never heard that you have to. I don't think I'd take a fresh delivery that's still got, I don't think I'd put
That
it,
was
you know, cause the heat water, the hot bathroom is probably, she's probably gonna pass out. I'd probably wait till at least 12 hours after delivery or the next morning. But yeah, I've never heard anyone say, you let her do a sitz bath at 17 hours? What were you thinking? Or anything like that. Another thing that, cause this is cute, right? But it's probably not the most comfortable thing. What I often tell moms is when you get home, if you wanna do one that's more comfortable, fill up your bathtub, then get into your bathtub and let the water keep running while you open the drain. So as long as the water is still moving around, you can sit in your bathtub and do the same thing. But you gotta keep the water running and you gotta pop the drain. Does that make sense? Okay. Alrighty. I just have, this is really old, but this is a personal breast pump. I just wanted to show you guys, in the hospital, they'll have a rolling hospital grade pump part, but the part that's the patient will need from the supply room is the actual plastic set with the cones and the bottles and stuff. And if someone's doing pumping, I don't think we're at the point of being able to teach them that, but a lot of times they may hand you the bottle, or you'll put the cap on, or they'll ask you to take the parts over to the sink or whatever. If you need any help with the pump, of course ask, but most moms aren't gonna just be pumping just because. You don't have to start pumping for any specific reason. A lot of times you're gonna see that their baby's in the NICU and can't breastfeed, so they have that stimulation. So, okay. should be warm, but I'm not gonna test you on that. Okay, I'm very big about you guys making sure, thank you, that whatever you're asked to do in the hospital, you know how to do it, and if you don't, you need to say, I don't know how to do that, or I don't know what's expected of me. Please explain. One thing I want to prepare you to do, though, is be able to help moms get up to the bathroom, okay? You will never, ever, ever get someone up to the bathroom by yourself the first time, okay? If it is her first time up, you do not get them up by yourself. But you can absolutely help another nurse do that. If she's been up a few times and just needs some assistance, by all means, help her in the bathroom. And we often volunteer you guys to do that, so there's no shying away from it. Okay, if you are gonna help someone up to the bathroom, it's a good idea to get everything ready before she's actually in there, especially if it's like the first or second time. It's good to have everything ready. It's the first time C-section mom. You're gonna wanna get her in there quickly and not dawdle, because the longer you dawdle, the more likely she is to pass out. Okay, so you're gonna get your new pad, new underwear if need be, whatever items you're gonna use for her peri-care. If she needs a new gown, you'll have that ready. And then a lot of times, especially if it's a C-section mom who's been laying around for a bit, she's probably gonna have lochia and stuff kind of all over. So you'll get wet washcloths ready as well, so that when she, in a gown, a new gown, so that when she's in there, you can help clean off her backside. I was wondering if somebody would be willing to hold the mannequin up, and I'm gonna demonstrate peri-care. It's supposed to be our lightest one. Thank you. Okay, this is always a fun one to use because she's got like a bunch of stomas. And I'm like, yeah, we see lots of those on the OB floor. Okay, you'll just, yeah.
This might be a stupid question.
It's not a stupid, and she'll be slimy, so you'll just hold, yeah. Just hold her right there.
Would you use I don't feel like you would. Would you use a gate belt?
No, we don't usually, that's a good question.
I didn't think you would, but
No, it's a good
you're always
question.
taught, don't, you know what I mean? So
Well, and especially like our C-section moms who have a bunch, like,
Yeah.
they're weak, you know, but I don't usually see it happen. But that's another reason why you'd have two people assisting with a pathway, but I don't tend to see it.
Yeah, I wouldn't assume.
No, it's
you
a
would,
great
but-
question. It's a great safety question. Okay, so I got my room set up here. I got my pad, and we decided with this patient, she likes the combination of Tux pads and Nupercanol, or I made that decision because she said whatever you think, and I've got it ready to go. I got the water bottle ready. I've got some wet washcloths. I got fresh underwear, and then a gown or whatever else I need. So I know this doesn't sound like it's a complicated task. I just think it is very simple, but I want you to see kind of how I do things. Because when you're trying to manage some of these bigger things, you don't want to flip in the toilet, you don't want her to pass out. Typically, when you're getting somebody up, especially the first time, and again, you're gonna be with someone, but talk to them. And don't let them look down. A lot of times if they look down, that makes it worse, or they get dizzy. And I tend to talk to them a lot because that's usually the first sign, if they're not feeling well, is they'll stop talking. So you're gonna walk them, support them, and then I typically say, okay, you sit down and I'll take care of everything else. If it's one of the first times up. If she's really independent, just needs extra hands, I'll do whatever she needs me to do. But especially if it's the first time, if there's a Foley or something, I typically have them grab the rail and I'll just say, you focus on talking to me, staying awake, and I'll do the cleaning. So if there's anything to take off, we're gonna take that off. And then I typically put the underwear on her legs first. and just leave that there. And then the water bottle, make sure it's popped open. And then you're just gonna either help her do it or have her do it if she can. If there's blood on her legs, then we'll just spray the whole thing. Sometimes if they've been in bed for a while, I hate to be blunt, but it's true. A lot of times there may be blood kind of coagulated in their hair. So if you squeeze this harder, that can be more forceful, or sometimes you'll just have to take a wet washcloth and help them wipe out if there's like blood clotting in their pubic hair. Okay, and then we'll dry her off to her comfort. If it's a first time vaginal delivery and she hasn't peed yet and thinks she can pee, you'll stay with her, let her do that if she can. Keep talking to her. You can turn on the water if they need some stimulation, and sometimes they just can't. Even if they know they have to, they literally cannot pee. So you'll do that, wait your turn, and then...
Would you want her to go pee before you did that?
Yes, I'm sorry, I should have said that.
And I was like,
Let her, do that. Sometimes I do just get them up though to clean them up. Sometimes they don't have to do anything in there, we're just cleaning them up. If she's like, I gotta pee now, and she's been up 100 times and it, it's fine, I won't like stand in there and watch her. But I'm real like, I gotta trust that they're not gonna pass out. But yes, you give them time to pee and then clean them off.
And you do that every time they pee. You want them to use that every time they pee,
Yes.
right?
And if they have a bowel movement, or if they're just changing their pad every time they're in the bathroom. Yep. Okay, so once I've cleaned her off, wiped her off, changed her down, whatever else was needed for hygiene. Remember I said that even though these have little stickers, it's almost useless to even try to stick them. So what I will tell the mom is when it's time to stand up, you just stand up, I'll take care of everything else. Because I don't want her looking down and trying to help me if she's still a little unsteady. So if you could go ahead and stand up, I'll take care of everything else. And what I tend to do, and I've got gloves on by the way, I should have said that. I will take the pad and do this. And then I'll have her hold this. So could you hold this, ma'am? And then I'll pull this up. And I'll have her help me to just pull up the front. There we go. If you try to put the big giant pad down here on the underwear and pull, it will flip into the toilet. So that's why I tend to kind of wedge it up here and then pull the underwear around it. So again, you guys know how to help people, but it's just different when they're bleeding all over the place and they're more sensitive. Thank you very much. Appreciate it. So we're gonna depants her now. The other thing I should have said too, is there a towel? We're not gonna dry off those hard patients. Instead, I'm gonna dry her off.
so it's okay for them to want to wipe, but normally they
It's okay,
will
usually
not.
you have, they
Yeah.
have, yeah. I don't,
Even if they have a bowel movement.
yeah, if they have a bowel movement, they can wipe however they want. If they have major hemorrhoid issues, or if they had like a third or fourth degree tear,
Yeah.
their stitches may be back in that region. So, but I haven't really heard us say you can't wipe back there. Usually they're more worried about,
Okay.
yeah, they're more tender in the front. Thank you so much. Okay, so I should have said this before. If they are getting up to empty their bladder, a lot of times the first couple times they pee, after a vaginal delivery we measure it. So if she just peed a ton, before I spray, I typically peek back there and see how many cc she peed. Because once I spray the bottle in, isn't that going to make it look like it was more than it actually was? So I'll just, say, oh, it was 600, and then figure off. Okay, any questions?
Do they usually use a commode?
No, they don't. I'm sorry.
So you'll have a hat in the toilet.
Yes. Yeah, and they'll have their own bathroom. Usually, what I typically see is the next morning. Now, if it's a mom who delivered vaginally, like at 6 a.m., she can probably shower by that night, no problem. But a lot of times it's just kind of the next morning. Especially C-section moms. They really want them off of IV fluids, saline locked, moving around good, support. And even if
my hardest part is not showering after.
Is that your like?
Yeah.
And then like with C-section moms, when I help them to shower for the first time, I always stay in the room, and I'll usually use that time to change the bed. You know, and I check on them quite a bit just because I don't know. I'm kind of like I don't like the idea of people falling, and I just feel like very quickly they can go from feeling fine to feeling dizzy. So usually the first shower, I'll tell them, especially C-section moms, let's make it a quick one and not too hot, because that heat's gonna vasodilate and drop the blood pressure. So.
Do you ever recommend them sit down?
Oh yeah, I mean definitely. There's usually a bench. Yeah, definitely. Okay, let me just scan my little notes here, make sure I didn't forget anything huge, and then we'll do our very last activity. Oh, I know. For postpartum assessment, wasn't there a question about what if we made it bubble pin? Would be the neuro. Why do we care about neurological manifestations?
One is because she just had like a baby, so that can put a lot of stress on her body.
Okay.
The headaches are common in the first week, however, it needs to be carefully assessed because they can be caused by
That's the big one. So usually, and all those are good answers. Usually what we're watching for are symptoms of preeclampsia. So you may see nurses do deep tendon reflexes, which we can practice doing. I always ask moms if they have a headache or any visual changes. What does visual changes mean?
Weird vision.
Spotting, yeah, auras around everything, especially if it's a change. I wanted to clarify with like the bathroom visit, if they're functional and wanting to participate, they can. I don't want it to sound like we have to do everything for them. I just, especially when I'm not sure how steady they are, their big focus is staying alert. But if she's doing just fine, she just needs an extra set of hands, but she's gonna do her bottle or whatever, that is absolutely fine. We want them to take part in their care.
And I had a question with like the fall waist type, because you know you walk with older people, you want to hold on to them.
Yep.
With these, are you doing the same thing?
I tend to, so if it's like a C-section mom, I treat them a lot like other surgical patients. So first we sit up, then we sit to the side of the bed, and we talk for a few minutes, and I'll say, how do you feel? And make sure their legs are wiggling. If they're still feeling totally fine, I'll say, okay, let's stand up. And I do that part kind of slow, because if they stand up and they're like,
Right.
I'm not gonna take them to the bathroom,
Yeah.
they're gonna lay right back down. But if they're doing fine, then I've got everything ready. I got the bathroom all ready. We're gonna walk in, we're gonna sit down, and I'm gonna make my part of it pretty quickly, or pretty quick. Because if it's a C-section, they're probably still gonna have a Foley, so they're not gonna have to pee. We're just cleaning up and walking. Get them back to bed, and now we've done our first little walk. Then later that evening, I'll probably get them up and try to walk into the hallway. And if I've gotten them up twice and they're seeming fine, they can then get up.
But it's not like, let me hold your arm. Like
I will tend to hold the IV pole if they still have one, and I kind of hold onto their arm. I don't feel like we're holding them up though. And if they're starting to get weak, of course you're prepared to kind of drive them to the ground, but thankfully I haven't really had to do that a lot.
Do they ever use walkers?
Not that I've seen. The only ones I could think of that might is if it's like horrible hemorrhage, went to the ICU, went through hell, and is just that weak. Okay. But I have not seen us use a walker just for like a standard C-section. Okay.
When does the Foley typically come out? I know.
Great question.
Epidurals,
Typically, they say the next morning.
Okay.
So a lot of times, like at 6 a.m., we would get everyone up, take out the Foley. Some places will say at 18 to 24 hours. They'll give you some
For
sort
a
of,
C-section.
for a C-section, yeah. You're not gonna see a Foley on a post-vaginal delivery unless she was unable to pee and her bladder became distended and it was causing an issue. They'll sometimes put a Foley back in, but you really won't see those on post-vaginal delivery moms.
Do you give Foleys to those with epidurals?
Yes, so when you get an epidural, they will then put in a Foley at some point, but we usually take that out right before we start pushing. Because if you push with a Foley in, then you're gonna force that balloon to come out when it's not deflated.
Yeah.
So we take it out right before.
How come you place a Foley with an epidural?
Because they can't feel to urinate, and so if that bladder keeps getting full, it's really
They're
gonna
just not.
hinder. I'm sure the baby can still get through, but you're putting a big giant water balloon barrier in the way.
Okay.
So then think about the time she goes to push. I'm sure you'll see urine. And that's no fun. You guys have really good questions. I think I got it. Okay. So I need like a 5-minute break for our very last activity. And when we do that last activity, one of the places we're gonna stop is to do a fundal check. And I'm gonna demonstrate that just real quick. So if you can't see me over here, come over here. Alright, so when we document about a fundus, what are the things we're gonna document? If you and your instructor go do a fundal check, what items or what facets are you going to document? Okay, and by location, what do you mean? Like South America, North America, or?
You can like use the umbilicus as a way to,
Yes, as a
measure.
global marker, yeah. Okay, so when you say location, are you meaning like how high or low it is in relation to the umbilical? Okay, so that's one facet.
Is it firm or soft?
Is it firm or boggy? Right. Okay.
Also with, like placement if it's midline.
Yes, very good, guys. So I want you to know, even if you don't see people do this, you need to do fundal checks with the woman flat. Why?
Because if there's
Gravity pushes things down, right? Okay, so if we don't have a resting universal position we're doing this in, isn't it possible that I could check her here and then she could be at 30 degrees when the next nurse comes in and he checks it when she's at 30 degrees? And how do we really know if it's what it's doing if we're always in a different position? Okay, so this is the correct way to do it. I'm not saying you're gonna probably see a lot of nurses do it this way, but this is the correct way to do it. And it makes sense why. So we're all in a universal position and we know that we're following the same process. Okay, so you guys listed very well the 3 things we're gonna document. So typically when you do a fundal check, first of all, you should never do a fundal check, at least your first one, without another nurse there. You need to have either your instructor or an RN with you. It is a very weird assessment because you're digging your hand into someone's abdomen. And a lot of times they're tender. Okay, we're also gonna provide as much privacy as we can. If there's a curtain to pull, especially if there's a door, you wanna close the curtain in case someone walks in. I tend to put my gloves on because I am gonna touch around the pad and I might encounter lochia or body fluids. So she's in a flat position, and I typically do it this way, and you'll see other nurses do it. You're gonna use your hand kind of like in a karate chop position, but you're not actually going to karate chop them. But your hand's gonna be like this. And so I typically start a little too high, and I kind of feel down, I don't find it. Scoot down and feel down, I haven't found it. Scoot down, oh, I found it. So I'm going to feel the fundus. I'm noting where I would document. Is it midline? Is it right? Is it left? And how is it at the umbilicus? Is it 1 below, 2 below, etc.? I'm noting if it's firm or boggy. And then while I'm looking at her pad, I'm just going to give a little push just to make sure there's not a bunch of clots that fly out. I'm not talking about an actual fundal massage like I'm sure you guys have read about. This is more of just a, hey, is anything hiding in there? And then, I've just done my fundal check. I've been talking to her about her lochia, and now I feel confident assessing this amount of lochia based on how long she told me the cat's been there. And I'm doing that all at the same time.
What do they do if
Good question. It should be midline, yep. If, first of all, what if we find a boggy one? Massage is typically the first step, correct. To answer her question, what if I come in here and it's nice and firm, but it's 3 above, it's to the right, way off up here? What are we gonna think or do? Yes, that is correct. If it is off to one side, 99.9% of the time, it's because her bladder is full. Now, why does that make sense? Because you gotta understand the anatomy. I don't want you guys to be robots that just say, oh, she told me to do this if it's like this. You need to understand why. So why does it make sense that if it's off to one side, it's up to the bladder? And where's the bladder in relation to the uterus? The bladder's under. Okay, so the bladder's closest to the exit, and then the uterus is on top. So if you think of, and we haven't gotten to this yet, but let me just tell you how quickly their bladders can fill up after having a baby. They have had all this excess body fluid for 9 months. If they're in the hospital, we've probably pushed a bunch of fluids on board, right? So very quickly, she can get 1,000 cc's in her bladder, which is astronomically higher than most people. By that point, most people will pee a few different times. Most of us sense the need to urinate around 200 to 300 in our bladder. Okay, so if you have a big water balloon of 1,000 cc's continuing to fill under a uterus, what's that uterus's job right now? Before we well, what is it? What's the uterus's #1 job after the placenta comes out? To clamp down and control bleeding, right? So it's trying to stay tiny and control and squeeze all the muscles down. So if underneath that, all these muscle fibers are being pushed up by a water balloon, at some point that uterus is going to fall to the side. And what we don't want to happen is if we don't get that bladder emptied, at some point it's going to keep getting stretched and it's going to be like, fine, I'll let go. And you can hemorrhage. So if you find it off to the side, we need to be thinking she needs to empty her bladder. And at that point, you know, if she can get up to the bathroom, we'll let her go to the bathroom. If she needs a bedpan, or she has if she's got that much in there and has no clue she needs to pee, she probably needs to be in that cath if she's not aware that she needs to pee. Yeah, and there'll be like an algorithm. First do this, then do that. So a lot of times what I've seen is we'll in and out cath one time if she's unable to urinate. I've emptied 2,300 out of somebody. If after that, within 6 to 8 hours, she still can't urinate, especially if her bladder's getting distended again, a lot of times they won't put a Foley in. Usually like 12 to 24 hours.
Just with all the...
Yeah, a lot of times it just takes a little while with after the anesthesia, the pregnancy, it just takes a little while for the sensation to come back. I'm not aware of hardly any.
Oh yeah, because like, I haven't really heard of anybody having that issue where they have to put it fully in vaginally.
It's not very common.
Like after my mom's cervical cancer and everything, like they, her bladder didn't come back so. I mean, it did now, but it didn't definitely.
Yeah, from all the different sensational changes with the pregnancy, the surgery, the anesthesia, it can just take a little while for some of those nerves to feel that. Okay, I'm gonna go grab one thing for our last activity. If you guys want to do the fundal practice and assess what you would document, we can discuss that, and I'll be back momentarily.
So if you feel this is going to feel like a ball.
So the difference is if it's not boggy, it's just gonna be soft. It's
fill it.
sing.
That's
No, that is a normal fundus. It's hard. Yes.
So like if you're like filling this, if the uterus feels like that, not good.
So if it feels hard,
If it feels like your normal stomach, like you're just pushing in a normal stomach, the fundus is boggy. Like it's gonna be soft. I mean, you're gonna be able to tell where the uterus should be at because they just had a baby, but it's not gonna be firm.
You're gonna be able to feel it
Experience it a few
in a-
times.
You know what to say for like textbook answers.
Cherries, maraschino cherries.
what does it feel like? That's hard.
Yeah.
So if it's hard, it's normal.
Yeah, that's good. You don't want it soft.
If it's soft, then it's an issue. For soft, it means it's not coming together.
Yes, it's not cracking.
My question is, if a normal person had these differences,
You're good. Sorry, Robin.
see what I mean?
In a normal
In a
person.
normal person who just gave birth, are those differences that obvious or they
Yeah, very
obvious?
A boggy version.
I mean,
But you know what I mean? Like, because I've never seen it or experienced it. I just
let
thought
us
it was
know
like,
if you'll experience it.
that's the home of
Yeah.
Because we start in the lab and she's the one that asked to go to college. But then you asked us to go to lunch every day.
I don't have any leftovers of it.
She went to grab something for our next session. So I don't know if she's in an office or. Sorry. Hey, how is the sugar-free Jolly Rancher?
It tastes like a Jolly Rancher.
Thank
You are a sissy. I mean, it was pretty good, but it's not just like, you know. Firm.